Hi, I'm Dr. Prathyush. I'm a consultant in medical oncology and hematology in Apollo Hospitals, Bangalore. So today we'll discuss about screening. So many people think that screening is done in actually patients. So basically, screening is not done in patients. It is done in healthy individuals to identify a cancer at an early stage or to identify a pre-cancerous condition which can turn into cancer over the next 5 to 10 years. So what are the screening tools which are commonly available? So especially in females, especially the patients who are above 40 years, 50 years, the most common cancers that we see, especially in India, is one is breast cancer, the other one is cervical cancer. The screening tool that we use for breast cancer is called mammogram. It's a simple X-ray where the test is done in 1 or 2 minutes. We expose both the breasts to the X-ray and then we see and decide what has to be done for that. So the mammogram, it should be started in females at the age of 40 years and then we do it every year. So, but there are certain patients where there is a family history of breast cancer where we use the screening technique almost 5 to 10 years earlier than 40 years. The second most important cancer is cervical cancer. For cervical cancer, we do a screening technique called pap smear, where we use something called an IR spatula. It is in the form of an ice cream stick where we remove some of the cells from that area and we examine it under a microscope and then we decide what to do further about it. So this screening technique generally starts at the age of 21. We do it once in 3 years. So there is some newer technique which is available, which is called HPV DNA testing. So as we know, cervical cancer, one of the most common causative agent is viral infection. To identify the viral infection in the body, we do a test called HPV DNA on the blood. So if we are using both the pap smear and HPV DNA, we start the screening at the age of 21, but we don't need to do it once in 3 years. We can do it once in 5 years.